Long bone growth occurs in two ways. One is when it grows longer. This is called the interstitial. The epiphyseal plates is going to be interstitial growth because they lay down layers of cartilage that lengthen the diaphysis or the shaft of the bone. Appositional is different. This is when your bones grow thicker, much like a tree. The tree grows taller, and the tree also grows thicker around as it develops its rings. Interstitial growth is when the bones grow longer as new bone is laid at the epiphyseal plate. We see the epiphyseal plate located in between the proximal epiphysis and the diaphysis. There's a layer of zone of resting cartilage, then a zone where that cartilage begins to proliferate and multiply, followed by the hypertrophic cartilage. Then we begin to calcify and form the bone itself. This is a lot like our skin. This looks familiar because it looks a lot like our skin, like an opposite version of the basal to the spinosum to the corneum. But in this case, we just go from cartilage down to ossifying cartilage down to bone. And the more we build on this, we push ourselves out. Now, appositional growth is when the osteoblasts build bone on the outside, while the osteoclasts reabsorb bone on the inside, widening the cavity. This destruction and rebuilding allows our bones to grow with us as we get older. You would not want bones that were adult length, but only the width of whenever you were born. They would be so tall and spindly and narrow that they would never be able to support your weight. So they have to grow with you. A disorder of bone that is typically seen whenever you get older is called osteoporosis. This is where the bone mass has decreased. It occurs with age, especially in women over 50. Bone density decreases to the point where even a sneeze could cause a vertebrae fracture. If your osteoporosis is bad enough, these brittle bones with large openings where we typically have that nice woven spongy bone, it could become so weak that if your grandmother were to fall down and break her hip, it might be that her own weight snapped and broke her hip, caused her to fall down. That's how brittle it can become, that just standing can cause your bone to have so much weight on it that it just breaks. Now, for you ladies out there, just FYI, you need some calcium to try to prevent this. It's necessary for proper bone growth and hardness. You obtain it through diet. Dairy, green, leafy vegetables, and salmon are all good sources. Vitamin D is also required to absorb that calcium in the small intestines, and we obtain that through diet and through sunlight. Calcium regulation occurs inside of our bones. Proper blood calcium level is essential for us to have muscle contractions, for nerve cells to function, to stimulate our heart, and for blood to clot. As you can imagine, if we lose this calcium level, then we won't live very long. Our bones contain 99% of the total body calcium. If you recall the osteoclasts, they're the ones who are destroying the bone and they release this calcium when we need it. Our parathyroid hormone and the calcitonin hormone regulate which of those cell types is more active. The parathyroid hormone is going to be used whenever your blood calcium levels fall below normal. Say you have not been eating any green leafy vegetables or dairy for the past few weeks. The parathyroid hormone is going to be secreted into the blood. It will signal the osteoclasts who break down bone to increase their activity, releasing calcium into the blood. Your kidneys are also going to excrete less calcium, and eventually we will raise that calcium level back up. Sometimes we might ingest too much calcium. In that case, the body wants to remove some of it. So calcitonin is going to be released by the thyroid gland. It will signal the osteoclasts to decrease their breakdown activity and for calcium uptake to increase from the bones. Basically, the osteoblasts, they get to work. They build bone using the excess calcium. But we're going to get that level back down to normal. Rickets is a situation where your bones can become soft and weak. They start to bow or buckle at the diaphysis. The part that should be the long and strong shaft begins to be weak, and it'll actually compress itself. This is caused by a vitamin D deficiency. A lack of sunlight can cause this, an insufficiency of vitamin D in the diet, or even a hereditary defect. These can become very severe, and the lower legs are just not strong enough to support the body weight. The chemical composition of your bone has to be just right. If it does not have enough collagen, it will shatter very easy, like rebar. If it does not have enough concrete, it's going to actually be bendable. So we need to have that perfect balance for strength and flexibility with our bones. Fractures are broken bones. A multi-step process is needed to repair a fracture. Whenever a bone breaks, it can break on any point in the bone, but depending on the type of bone, if it's a long bone, and where the stress is applied, if it's twisted, you can have various fractures. But the process is the same for healing. It starts by a fracture hematoma forming around the break. This collection of blood is going to help to repair it. New blood vessels grow into the hematoma and an internal and external callus forms. This callus is to protect the area. Eventually, a hard callus forms, providing a substitute for the bone itself. Initially, this is spongy bone. Finally, the bone is remodeled. The fracture completely heals, and osteoblasts are able to completely repair the area. After a fracture, that part of the bone is actually stronger and denser than the rest, so you will very rarely have a bone break in the same place twice. If the bone itself breaks, it'll probably break somewhere else other than at that exact healed fracture. Bone healing is quickest in children, and it slows down as you age. It's just harder for the body to go and completely reform that. If a patient is old enough, it's possible that a fracture may not fully heal. Fractures can be open, where one end of the bone is actually exposed to the outside. This is one of the most dangerous because the exposed bone can allow bacteria and an infection to get inside. The second one is a closed fracture. This is when the bone breaks, but it basically stays in position. It does not puncture the skin. That one's safer because you're not exposing it to all the external bacteria. Stable versus displaced means, did the fracture happen and the bone stayed in position, or did it move? With displaced fractures, you're probably going to have to go in and have that repaired to where it's once again aligned in proper position for it to heal. Surgeons can use rods and pins and screws in order to help get that bone into position. When it's one like the femur in the leg, there are a lot of muscles pulling on that, pulling up and keeping that area contracted. If a bone is displaced during a break, those muscles pulling at both ends can actually contract it to the point where the ends pass each other. So you might have to surgically go in, insert pins and rods in order to keep it in position where it's going to be able to heal, especially if there's fragments as well. A fracture that is often seen in children is a green stick fracture. Their bones are a little more flexible, so if a bone bends and it cracks some, it might not break all the way through. These tiny fractures are called green stick fractures. They heal up much faster than it would a full fracture, especially because we're talking about children. If you recall, they might have more red bone marrow, so their blood supply to their bones is better than an adult who has yellow bone marrow. And that completes our bone chapter. See you on the next chapter.